The day after we called hospice, she was at our house and she greeted us with a hug.
If I had any pain, they were able to take care of that.
It's like a family here. I've never seen anything like it.
That it really is such a gift, and it's such an honor to be able to take care of them in their own home.
The difference between hospice and hospital-based care is really a matter of a philosophy. Hospitals and the medical community are still looking to cure and to treat a disease. In hospice, it has come to the conclusion that that patient's disease is untreatable, so the focus is more on caring than curing.
What brought me to hospice was my youngest son, Kyle. He was diagnosed with a malignant brain tumor when he was 10 months old. I knew very little about hospice. All I knew about hospice at that time was that it was a group that allowed you to die at home. The boys loved their brother, spent as much time with him as they could. During the time that Kyle spent in the hospital, our family was really torn apart because the boys couldn't be at the hospital with us. Diane Marie Coughlin came into our home the day after we called hospice. She was at our house. She really embraced all of our family, not just my husband and I and our children, but our family and friends that surrounded us during that time also.
It was still nice because I know there was someone there, and I always knew there was going to be someone there.
When he was home during that time, every minute of it was a blessing to me and a joy. The time to have that privilege of having him die in my arms, it was the greatest privilege and the greatest gift next to his birth.
The criteria for being on hospice is, having a terminal prognosis of 6 months or less, and that could certainly mean that people will outlive the 6-month period, such as Connie.
My doctor recommended that I had to get out of the hospital, and he said he had heard that hospice was very good, so I was out of there that afternoon. She is just one peach of a person. I trust her with my life.
I have great-grandchildren, and some of them are too small to understand what is really going on. And of course, to be home, I can entertain them more, and to get some enjoyment out of them. And letting that period of time in their life just to disappear, for me is wonderful. Actually, I was extremely happy and pleased that I became part of the hospice program, and because if I had any pain, they were able to take care of that, and it means that they call on the house. I didn't have to go to a hospital or do something else like that,
When you're in the hospital, you're at the mercy of the orders and the doctors. But I say to families, I will suggest to you what I feel will help, but it's your choice. And that's how I give the control back to the patients.
I think people feel most comfortable in their home with their family members and friends around, with their belongings around. A lot of people that we cared for have been in a hospital setting for a long time. They miss their own life.
I feel end-of-life medicine is something that should be very flexible. And if you say there's only one right way to take care of someone, for example, who has pain or shortness of breath, you won't be a good hospice doctor. You have to consider what the family's considering, what they feel like. Their role in this is really important. So I try to work with the patient, families, those who are involved, to bring as much comfort as possible.
And the services I would bring would be weekly visits, sometimes more often, to really go and be present to them, to hold them in a sacred space, so to speak. One of the patients that I saw many years ago now was a patient who actually was quite familiar with hospice. They had done some work for them. The patient's name was Tom and his wife Peggy.
When my husband was diagnosed with kidney cancer, he was 48 years old, healthy as a horse, had no symptoms, and so not only was he diagnosed with stage 4 kidney. It had already metastasized. He had a nurse that stayed with him through the whole process. He was in for a few months. We had a social worker who answered all the questions that the family was concerned about finances and things like that, and other care besides just his medical care. We had a chaplain come to the house.
We in hospice, we're not going to pull out the minute that this is over for you. I said, we stay in there. You know, we've got a wonderful, what we call our bereavement program, that will be there with Peggy and the children in whatever way they want.
When they checked up on us for a year afterwards, we would either get a phone call or we would get a letter. And it was nice to know that they were there checking up to see how we were doing.
Every time you walk in, everybody has a smile on their face, and they are very encouraging, and they are very, you know, they'll give you a hug and let you know how much they care, and they show it not just in, you know, words, they show it in actions. I mean, the way they are with my mom, the way they are with me, you know, it's like a family here. I've never seen anything like it.
When my father passed away 30 years ago, the pain control was horrible. I would be on the phone to the doctor, but there was no continuity. We didn't know what kind of pain he was in. I had morphine and I was giving it on different time frames, but it was either too much or it wasn't enough. And I would be on the phone to the doctor, but you know, they couldn't do anything because they couldn't come into the house. What a difference with my mom. I mean, with hospice being there, my mom was not in pain when she was, to the day that she passed on. This is the truth. She was looking through magazines and ordering clothes. And they came 2 weeks after she passed on, but that was my mom, you know, she just loved shopping, and there she was. But there was no pain, and she loved seeing the people, her friends who came to visit. It was just such a difference. It was like night and day.
My girlfriend was 45 years old. She did not want to die. She wanted to fight, fight, fight. That was one of the problems in the beginning with hospice. We equated it with death. And at the end of our hospice experience, we equated it with living and life and comfort and support and so many wonderful, wonderful things that we did not know about when we first started this whole journey. Many people think that it's really difficult to be in a position where you're taking care of somebody who's dying or terminally ill. And once you do it, you find out that it really is such a gift, and it's such an honor to be able to take care of them in their own home, where they're surrounded by the people and the place that they love best of all. And it was a privilege to take care of her, a privilege for everybody, for all of her friends and all of her family.
All of us as a whole, as a staff, I have never seen a more compassionate and caring staff than I've seen here.
To be able to live your life, you need to be comfortable. And that is what hospices strive to do, to make sure that you are comfortable both emotionally and physically.
The choice is not only for my mother to get the level of care that she deserves, but the choice to end her life with a semblance of dignity.
I've worked in labor and delivery, which is a warm, happy, wonderful place. And coming here to see these nurses give all that they have without reserve, using their expertise to make that family comfortable is just amazing to watch. It's been incredible.
Hospice is my heart and soul. It's my passion. I can never stop thanking them for what they gave my family. They saved my life.